On August the 24th, 2023, the Speaker created the Assembly Speaker's Task Force on Childhood Obesity and appointed me to serve as the task force chair. The task force was directed to study childhood obesity and weight management. The task force was tasked with considering circumstances contributing to childhood obesity, including physical activity, nutrition, medical, and other root causes, as well as physical environmental factors. We also reviewed current and past efforts to prevent and improve weight management in order to consider and build upon effective practices. Following these efforts, the task force was directed to consider recommending legislation in school-based efforts to impact circumstances contributing to childhood weight management, parental support for and education on childhood weight management, early interventions and screenings to better identify and promote healthy weight management, removal of potential barriers and promotion of better access to proper nutrition, spaces for play and other physical activities, as well as data collection efforts and implementation of childhood weight management interventions. After the appointment of the additional 7 additional members, the task force held 6 public meetings throughout the state for the purpose of receiving testimony and recommendations for legislation to address childhood obesity in Wisconsin. We heard from many organizations and individuals throughout the state regarding the childhood obesity issue. Additionally, we solicited information from and conferred with the Wisconsin Department of Health Services, the Department of Public Instruction, the Department of Children and Families, and the Department of Military Affairs. The reason we checked with Military Affairs is that we found out the number one reason that young men and women are disqualified from service is because they're obese. The National Conference of State Legislators researchers, they also came to Madison to give testimony on our issue. The bills before you today arose from these hearings and subsequent discussions. Childhood obesity is a problem in the state of Wisconsin. 10% of children ages 2 to 5 are obese. 15% ages 6 to 11 years old are obese. 18% 12 to 17-year-olds are obese, and it continues as our citizens age until 47% of our current population at age 65 is obese.